It's Rita at Gold Medical Jobs. How is everybody? Thank you for coming back and visiting us on Facebook. Today is Wednesday, the 14th, and generally on Wednesday we have Mary, my dearest friend, also a nurse, speaking with us. But she's a new grandma and she was needed in her grandma role today, so we don't have Mary. So you just got me. Anyway, so when we get Mary back, we will talk more about the direction she's taking with her new business, Vizenda. So she started that recently, and so we have a lot to learn from her in that area of healthcare, which is wellness and maintaining wellness and all the things that she's doing for her clients. So we will talk to her about that. It's like an arrow in the middle of my face for some reason. Anyway, so I'm just going to stick with employers and employees and nursing tips. I've been a nurse for, like 100 years. No, actually started nursing in the 70s, 1977. And here we are in 2019. So a lot of years. I've been a clinical nurse most of those years. I've done a lot of administrative nursing in the last couple of decades, actually. I started, I never stopped being clinical. I always maintained being clinical, either part-time or full-time along the way, because I love it. And but I became administrative back in 1997, I believe. So 20 years into my nursing career, my clinical career, I started administrating, and I started a nursing agency, and then I went on to management and clinical supervision and so forth. So I think I want to do like a Gold Medical Nursing 101, not to teach you, you know, your skills, because you have those skills and you're honing those skills, whether you're a brand new nurse starting your career, or whether you're a nurse having been in your career and maybe making a career change. So so let's just start with some basics. Only an RN and representing a esteemed profession and providing a necessary service for people in need, but you're also an employee more often than not. Very few nurses work completely independently, unless they're running their own practice, and then they probably work as a team member or a team leader. So the first thing is grooming. It's important to be well groomed. That means you are well groomed. Your hygiene is impeccable. Your nails are short and clean. You wear minimal jewelry, maybe just studs, not danglies like I'm wearing. And your clothes are clean and pressed, not, you know, with dozens of wrinkles having just been pulled out of a laundry bin. Okay, so you're well groomed, so you can care for others because you've already cared for yourself. It's always a good idea to have something to eat, even if it's just something, a smoothie or a glass of milk or protein shake or a piece of toast, an apple with peanut butter. You have sustenance, because most of us sleep at night. If you're lucky, you sleep well like a baby. But so you're well groomed and you've taken care of yourself. You've had something to eat and drink. And here's a huge one. Okay, 1A, well groomed. 1B, show up on time. And if you show up, if your shift starts at, let's say 7 a.m., and you show up at 7 a.m., you're already late. That's what all the years that I employed nurses for agency work, they were required to show up 15 minutes before the shifts start. So they didn't get paid for that. They were just doing something that was prudent. Not 30 minutes, not an hour. That's annoying. But 15 minutes minimally. Okay. So if your start time is 7 a.m., you plan traffic, whatever, getting gas in your car or meeting your carpool, whatever. You plan with 15 free minutes prior to shift to where you arrive. So you take off if you're wearing outerwear, your purse, your lunch, whatever, you take care of that. You show up on the unit in the next few minutes, fresh and ready to go. The next shift is you've seen relief in their eyes because you've arrived. And if you're new, then you orient yourself. Maybe maybe you're in your orientation phase. You kind of go down the halls and reorient where the clean things are kept and the dirty things are kept and the medicine is kept, and you just kind of reorient, you relax. Maybe you get yourself something to drink, and you're prepared to take report as soon as the person in charge or the person that you are going to speak to is ready. So showing up on time means actually showing up 15 minutes minimally early. Okay, minimally about 15 minutes early, 10 or 15 minutes early is absolutely fine. If you're there for too long, then you may be in the way when people are trying to wind down and complete their duties. And they may feel compelled to talk to you, and then they'll feel frazzled because they weren't done. So, okay, so 1, take care of yourself. Get groomed, brush your teeth, clean your nails, comb your hair, make sure you have clean garments on. And then 1B is show up on time, which means a few minutes early, okay? I want to give you 3 things. So you show up on time, and I guess number 2 is to be a good listener, okay? So when you're getting orientation, when you're getting report, if you're reporting to a hospital, if you're reporting to a clinic, and if you're going to a home health situation, you have to gather information, right, before you go rushing off to see your patients, whether they're in a room, they're in a waiting room, or they're in a hospital bed, or they're waiting for you in their homes. You need to gather information. So number 2 on your list is listen and gather the appropriate information. And I understand that can be distracting because in some situations in bigger facilities, there may be other people around doing the same thing, gathering information about their patients while you're trying to gather information about your patients. So, so gather your information. Be prepared for that. Make notes. Take pictures. Maybe there's a care plan. Maybe you're getting it on a computer. Maybe you're getting a printout. I always suggest when I'm talking to new hires to go to the dime store, go to the Dollar Tree or someplace, you don't have to spend a lot of money on this at all, is get a little tiny, about the size of a cell phone, right? A little tiny pad about that big. What do you think that is? 3 inches by 1.5 inch, something like that. Get a little tiny pad and pocket that. One thing most nurses really appreciate in their garments is pockets. So you may have a rear pocket to your pants. You may have pockets in both of your scrub top if you're wearing scrub tops. So pocket a little notepad. It will come in so handy. For example, if you're a home health nurse and most of your information is on the computer, but maybe you don't have directions, or maybe they brought a new physician into the system, to the case, you jot down a mobile number, or just so many little details that come up as you're listening and getting your report, and they say, oh yes, in this case where they've had hip surgery and so forth, they've brought in maybe, oh, what's the word I'm trying to think of? An infection control nurse or an infection control physician. And that will be Dr. So-and-so or the PA so-and-so, PA Smith, Dr. Smith, or Nurse RN Smith. And you will be getting a call from her at 2 o'clock today. And you say, what's her number? Well, you would have to call the primary physician. But you maybe just jot the name down and write 1 p.m. down, because that's newer information. It isn't on any of the printouts. They don't have specifics to tell you about, but you know that much. You know that the infection control specialist, Mr. or Mrs. Smith, PA, MD, RN, whatever, will be checking in on the case at 1 p.m. So in addition to everything else, you just want to have that fresh because that's new information. So number 2 is listen. Gather your information and do some good listening, because that will spark all that you need to know for your shift, and then it will spark in you maybe things that were left out. So if the primary condition is orthopedic or status post burn, and now you have a secondary situation, blood sugar out of control, or infection has spiked, or, so you're gathering your information and you're asking pertinent questions about either the primary diagnosis or the secondary. So gathering information is very important and helps set you up for a better shift. So 1, 2, 3. What's the third thing I can say? I think attitude has to come into place. Okay, so we talked about grooming and appearance, taking care of yourself before you can take care of others. I think attitude. So one of the things when I coached my nurses coming into an agency or out in the field working for a travel company was to use their time on the job as a little break from their everyday worries. You're worried about your child. You're worried about your aging parents. You're worried about those last harsh words maybe you had with your significant person, your husband or your wife. It's a good idea to take the time that you're working to leave those problems at the door and to start your shift fresh with a fresh attitude, with a professional attitude that I want to put my best foot forward and do the best I can for the people I'm here to take care of, and clear your mind and have that fresh attitude. And amazingly, you're much better able to focus. Turn your cell phone. Oh, I guess I'm going to add a fourth thing. So yeah, so my third thing is definitely attitude. If you show up on the job like this, oh, good morning. Nobody wants to see that. But if you show up on your shift like this, good morning. How are you? How can I help today? I'm ready to go. If you show up with that willingness, that openness, that pleasantness, so much better for you and so much better for everyone else around you. Okay, and then I'm going to say number 4 is be appropriate. So number 3 is good attitude, be pleasant. But number 4 is be appropriate. You're going to see people doing inappropriate things, but that doesn't mean you should. Oh, no. Oh, no. So if people are, oh, my gosh, I talked to a nurse working in the ICU one time because the supervisor called me and said, this nurse is watching a movie on her smartphone. And I said, I'll contact her right away. That's not appropriate. I'm so sorry. And no, phones are for emergencies. You have to leave. That's like leaving your children with grandma or in childcare or your bills to be paid. That stuff gets left behind when you go to work. You're working, you're being paid, and you're supposed to focus on that 100%. Okay, not on your paycheck, not on your taxes, not on the conversation you had with your husband or wife. No, The phone is an emergency device, and particularly for the home health nurses and so forth, it may be a business phone, or for the administrative nurse, it may be an administrative phone. But when you're one-on-one with patients, when you're working and taking care of others, that phone gets pocketed or left in your purse, in your locker, whatever, and it's for emergencies only. Somebody needs to get in touch with you. They know how to. Your child care provider, your parents, your spouses, whoever needs to get in touch with you knows you're working and probably has your work number. And yeah, if there's an emergency, believe me, you will be found. So no, you don't make phone calls. No, you don't do texting. No, you don't watch movies. Good grief. And yeah, so be appropriate. That's my fourth recommendation. A lot has to do with this cell phone. I've had so many conversations with nurses that I was counseling or managing, or what was a clinical manager I was, and supervisor, all of that. So many conversations had to do with that, and there's no reasoning for it, and no excuses for it. And if others are doing it, that's not you. You're in charge of you. You're not in charge of others. Okay, so yeah, be appropriate. So that's my little tirade for today. I think it's all kind of basic standard. We know it, but it's okay to be reminded of it. So I'll just review real quick, and I hope I'm helpful to you. That's my goal. That's my goal. That's what Gold Medical is all about. We're all about great nursing employees, and I'm sure most of you are, but those little things can get into big things, so one little bad habit can grow. So if you just answered that phone because you knew your daughter was on her first day of school, or her first tryout for the cheerleading team, or your son was at first football practice or whatever, it just has to wait. I mean, you will get a break. Every 4 hours, nurses are entitled, oh, you know what? I'll give you 5. Number 5, take your breaks. They refresh you. They reorient you. They relax you. You can maybe change your socks or your shoes. You can have something to eat. You can maybe take a walk. You can maybe just sit, because nurses run around quite a bit. So I'll add number 5 as a really important component as the basics, is to take the R&R that you so deserve. And that's when you can look at your phone and make your phone calls if you want to. Maybe you don't want to. I kind of resent my phone sometimes when it rings too much, or there's too much going on and I keep getting pulled in so many directions. So, okay, we'll go through real quick again. 1A, take care of yourself. Okay, be groomed, take care of yourself, and have breakfast, small, little, whatever. I sometimes really want a hearty breakfast, and sometimes just a little breakfast. So whatever pleases you, whatever your mood is directing you for that day. So take care of yourself, 1A, and grooming, 1B. Now I'm losing track. Take care of yourself, 1A, 1B. Oh, your grooming, I guess, is your clothing and your hygiene and your clean nails and all of that. So that's number 1. Number 2 is listen, gather information, be a good listener so that you know best way to start your day. And 3, what was 3? Boy, short-term memory is not good here. The grooming, take care of yourself, hygiene, listening, gathering information. Gosh, what was number 3? Tick-tock. Number 3, I'm going to skip number 3. Hopefully it'll come back to me. And then number 4 was be appropriate. Be appropriate, particularly with the phone. Phone is not meant to be in the workplace unless it is a work phone. And then, of course, if it's being given direction, somebody needs you in the next room or the waiting room, or your supervisor, whatever. So the phone, if it's a work phone, that's one thing. But you're not watching movies, you're not making calls, you're not making texts, you're working. So keep in mind to be professional. And then I just added number 5. Oh my gosh. Maybe you could rewind this video and get all 5 of them. Number 5. Oh, I know what number 3 was, or number 2 was, is be on time. Don't be late. Be 15 minutes early, be well prepared, time to park your car or get stuck at a traffic light or whatever. Give yourself at least 15 minutes extra to arrive. Arrive 15 minutes extra, and it's good for you and it's good for others. So that was number 2, and number 3 was listen and gather information, get a good report, and number 4 was be appropriate. Oh, I know what number 5. Number 5 is attitude. Have a great attitude. And it's also good for you to, if you're troubled by something, and we do have bad Tuesdays or bad Wednesdays, if you're troubled by something, leave it at the door. It'll stay. It'll stay. I mean, if you're that troubled, you should be at work. That's an unwell mind, an unwell spirit. You know, I've had tragedies. My sister died several months ago, and I have days that I'm just crippled by the pain and the loss of that. And those are days not to, you know, to take the time, whatever it is. Sometimes it's just you need a few moments, but sometimes you need more than that. You need a walk in the fresh air or crawl back under the covers and get some extra sleep. But for the most part, most of us can function. Most of us are professional and responsible and show up for work and leave the troubles behind, you know, and enjoy focusing on your patients and on your work, and you'll have a great shift. Okay, so that's 5. They were a little mixed up because I was a little mixed up, but I hope those tips are great reminders for you, and I'll continue to give you more because great employees help make a great workplace and happy employers. Okay, that's what Gold Medical's focus is. Take care. I'll see you soon. This is Wednesday and the 14th. I'll see you on Friday, the 16th. I think Friday. Yeah. Okay. At 10:30. So Mondays, I'll just reiterate, on Mondays and Fridays, I usually get on here on Facebook at 10:30 Pacific Standard Time, but on Wednesdays, 1:30 Pacific Standard Time. All the best. Thank you so much, and good health to everyone.